So years ago, we developed a patient education binder. It was about 30 pages, and it was reviewed during the treatment education session with our mid-level providers. And then we thought it was going pretty well. We reviewed it. It came with a calendar. We encouraged them to bring it to all of their other physicians and look at it as more of a big picture and have everyone add to it. But then when we sat back and really reviewed that, we were still getting a lot of phone calls to the practice for things that we kind of covered already in those visits. And then we met with patients and did a satisfaction survey. Where did they think the holes were in our education process, and how could we improve it? So over a period of time, that binder grew to 93 pages. And that is what we have now and utilize today. Now, 93 pages is a lot, and let's be clear, we don't go over all of that with them during that visit because that would be very overwhelming. But what we did is we evaluated how it was written, and we all thought it sounded great. But we actually needed to bring down that health literacy level of what we were providing the patients, and that was one of the holes that they identified. There was also this huge request for more information, not necessarily to go over it during that visit, but serve as a guide, a Bible, a resource to help cut down on those calls to the practice. And that's what we've developed. So we tailor it to every single patient that enters that practice. They receive drug-specific information as well as drug-specific side effects. We talk about court care. We talk about nutrition, mental health. The mental health segment's actually been really interesting because we do not have mental health providers on our staff. But mental health is something that many people need in this day and age. But when you're in a time of crisis, the last thing you want to do is start calling people in the phone book and hope that they may call you back. So we spent a period of time over the last several months doing that ourselves for our patients. And we developed a front and back that we include in that binder. We vetted all of our mental health professionals within the area. Do they see cancer patients? Do they take insurance, cash pay? And we put all of that in there for the patients. And our satisfaction scores on that have been tremendous because, it's not only the patient, their caregiver, the children, they all need or want access to that, and we want to be able to provide that. We do financial counseling assistance, that's in there as well. And we have found a great resource called Patient Resource Connections. It's a live website, and you go into that and you put in the patient's zip code. And in live time, it pulls up all of the resources available for that patient within their zip code, whether it's financial assistance, transportation assistance, the local food bank, even supportive care services for mental health needs. And again, those are things that when we're looking at the patient now, we developed that whole education guide, not just to be about the drugs, but to look at the patient as a whole. We talk about our survivorship program in that binder. Because really from the day you're diagnosed, you're a survivor. It's not something that we felt we wanted to address on the back end. We wanted to begin those conversations in the beginning. We talk about advanced care planning because we need to kind of change that narrative. Advanced care planning is not giving up on something. I've had advanced directives since I was 21. Part of that is just responsible adulting. But again, those are conversations that we want to be very transparent about and very open with, so it doesn't seem like that elephant in the room if and when that time does come.